If you are,
You. Good to see you.
okay, oh, and I meant now that our recording has started, thanks to Cameron. At 6:38, we have, called the meeting to order. My name is Lapita Henry and I co-chair along with Cameron Clark, the Health and Environment Committee. So you have just acquired the agenda, which is up there. I accidentally sent Ashley the wrong agenda. And so now we have the uh May agenda. So recognizing all of the activities dedicated to this month. Mental health awareness, which we adopted as an ongoing focus in 2022, physical fitness and sports, women's health, skin cancer prevention, the whole works. You'll see the link to learn more about the other healthcare concerns designated in the month of May. So, do we have anything to add to the agenda based on what you're looking at now? I actually will subtract from the agenda, allowing our guests a couple more minutes. Cause usually it's 8 minutes. You did say 10 minutes would be great. Seems like we have it. And maybe, oh, and I'm gonna subtract, New York State Technology Report for this particular, meeting. Okay, so, can I have a motion to adopt the agenda unless there's something else to be added? I subtracted.
Remove. Seconded.
Sure. Okay, so properly moved by Lena and seconded by Jordan to accept the current agenda. Now in terms of the minutes, that's incorrect. It's both, I know what happened, but anyway, it's the March and April minutes.
I move to adopt the March and April minutes.
And actually, I should correct it. The March is a summary and April's actual minutes.
I move to adopt the March summary and the April minutes. Second.
Been properly moved and seconded. All those in favor, say aye.
Aye.
Heather, do you say aye? I think it's unanimous.
Unanimous consent.
Okay, and let's see, on the screen, hi Chris, hi Wendy, I don't see, oh, there's some. Oh, Patriana is there, good, okay, I don't see Polly. On the agenda unless she's just missing from my view. But I want to take this opportunity to thank Pauline Ferrante. She's our liaison, Community Board 9 Health and Environment Committee from New York City Department of Health and Mental Hygiene. And she was called upon to help us reach Commissioner Dr. Alistair Martin for our public health forum, held on April 11th at City College in conjunction with CUNY School of Medicine. And he responded right away. I believe we might have been his first non-agency, non-political group, I should say, to have him meet in the community, first community, and he was fantastic. And we have pictures, like he actually took the picture of the entire group. There were about 70, it was a little bit over 70 at the luncheon. And he was like, just a kid. He was talking about his young sons who taught him this whole thing of the group, the selfie. And so anyway, he took it and every committee member's there. It's just that, it could be a little more clear. Every single committee member was there and then he's got us in the photo. So, anyway, we appreciate that. And, so that's thanks to Pauline. He was accompanied by, Kenneth Johnson, his, I guess that's sort of an advanced person for these kinds of events. Cameron, do you have any outreach, not necessarily to Pauline?
Legionnaires.
Yes, and Victor sent something from it, might be the same information, but yours might be different.
I think, yeah,
Let me see what.
no Legionnaires
you go
are things
ahead.
that I,
You don't have anything. The good thing is from, Victor, our Victor Edwards is our chairperson. Or chair, not familiar, has been attending, the latest, building with the latest incidents of, Legionnaires, and that's 3333 Broadway, which is just up street a couple of blocks at 135th. And, I mean, with that complex, 5-building complex, there's been tremendous turnout and people really, demanding fast action, how, that there should be more communication with the owners and, particularly the residents should be in the know. And certainly with the city as well, most importantly, scheduling those, inspections and keeping those in connection with, we have a full house now, there's one.
Thank you.
Yay.
Sorry.
Yay.
all good.
So just, scheduling, those connections for us. And Victor has been stalwart in being present. There was a press, conference when, initially when it was discovered. And this was almost six months, almost on the heels of the previous Legionnaire, incident that involved 7 buildings. So we're very pleased. I attended one of the meetings. Victor has attended all of them. And some of the others have to, Monique has attended. And, I'm not sure how recent the last one was, but the main thing is that that building owner and his partner are following up. They have scheduled inspections, and follow-up inspections. Everything is, negative. And hopefully that will remain so. And, there's a desire for even the building closest to it, those two, that did not detect that, whatever it's called, bacteria be inspected. So that I don't know. I don't think they're doing that one immediately, but they are going to be following up with that. They're taking under advisement the residents concerned that should not wait until something appears there, but be on a schedule. They should start that schedule. And of course, there was some announcement about the city and the city itself being more responsible in tracking their own, data and following up, because the buildings over the summer were primarily city-owned buildings that should have been inspected by Department of Health and Mental Hygiene. Any additional there?
No,
Anyone
I
else?
know there was a meeting, on the 28th, like a convening, but I didn't attend it. I don't know if Victor. attended it.
Is that the Legionnaires group from Harlem?
No, this was Cranes, the journalism group, and the Plumbing Foundation convened a meeting.
I had wanted to attend that, yeah, but, dealing with water, the whole issue of water, yeah.
But
And so I think when I got it, I emailed it out to the committee as well on the issue of water sponsored by Cranes Your Business. I know we get a lot of email, but still, we could just, all we can do is try.
Chris was the one who sent it, so maybe.
Yes, Chris.
Johnson.
And I think I forwarded, Chris, I don't know if Chris, I don't want to put you on the spot, But were you able yourself to go to that meeting on Crane's, New York business? Can you guys hear me on those on the video?
Yes,
Video.
yep, can hear you, Laquita. Mm-hmm.
But Chris may be away.
Yeah, you might be away from this.
Yeah.
We can come
We
back
still- we
later if he's.
If he has information
Yeah.
to share, you know.
Where you going?
Okay, thanks, Rita.
You're welcome. Have a
Um,
good meeting.
Okay. So the very next thing, then, nothing else on COVID, measles, immunizations. But again, thanks to Pauline, for her diligence and following up with us, getting the questions from us and anything else we needed to know relative to Commissioner Martin. And he was great. He was great.
You talked about the health fair already?
You know, I talked about thank Pauline for
Alright,
helping us steer that.
alright.
Okay, so now Cameron.
Ooh, all right, so very, very briefly, I know Arnaud is on the agenda. Yeah, so,
I just put any,
yeah,
all the things you're involved with, because they're really
For sure.
important. You could just give us a sentence.
yeah,
Yeah.
so we had a community fellow that was working with us, for the past few months on a report on supportive housing and affordable housing. That report has been finalized, we're still cleaning it up and, you know, making it pretty. But actually, when he presented it to the general board meeting
Mhm.
last month, a representative from the mayor's office was in attendance, and he actually requested the report, so we.
Wow,
Something like a
fantastic.
pre-publication version of the report.
Oh,
So,
nice.
you know,
Quit,
might
so,
be sitting on the mayor's desk somewhere. We're gonna be having, once I get out of, have a little bit more free time, we're gonna have, some meetings on like how to move forward with
Oh, yeah.
publishing it and disseminating it a little bit more widely. And then how to, you know, use some of the highlighted numbers from the report to generate a little bit of, you know, maybe attention, press coverage, stuff like that.
did he graduate already? No, it's coming
He's
up.
graduating in May, yeah, so. probably a
Okay,
couple
and
weeks.
that's really something
We also-
great to have on
yeah.
his resume.
Oh, yeah, we sent a commendation to his dean, on Victor, from the sheriff's board. Yeah,
Mhm.
just commending him for like the great work that he put into the report. And yeah, so I think,
So let me add that we all feel so proud of that project. It came out of, I don't know, I know Monique and Victor, you guys sat on the committee to decide, what subject, and whoever came up with housing and then the health and, you know, committee involved, that was super. And then, Cameron was tapped to be the liaison, and he and Arnav worked very closely. And just presented a beautiful presentation that, bless you, supports at what we've been talking about for a number of years, but here's actual data that he came up with. So we're all very proud of it. Thank you very much, Cameron, for, you know, being the liaison and representing.
I said, go ahead,
what's
Lynn.
up, questions?
Yes.
Yeah, report.
Well, once again, great work. The, question I have is getting the information up and out to the community in, you know, more simplistic, digestible form,
Exactly.
especially on our website,
Yeah.
so that we can direct people there, because that was the whole point
Mhm.
to, you know, share it. So I don't know what the timeline is on that, but maybe that's just a further conversation to have.
Yeah. Yeah, I mean, I think it's probably gonna be like you know, some sort of social media campaign. Obviously, we have access to the Link NYC kiosk. I
Yes.
think that there's a bunch of different ways that we can sort of take some of the conclusions of the report, shrink them down into bite-sized chunks, and then give folks a call to action of what they can do. You know,
At least the two committees so that we can be
no,
involved.
this is all
I mean, you
key,
did it now, but I mean, when you,
it's all gonna be like, we're gonna have meetings about this, you know.
yeah, so that everybody has some.
Everybody will be
Ideas, we're
invited.
all so proud.
I had some other thoughts. So one thing is
community facing,
Yeah.
right? But the other is more policymaker
Mhm.
and press facing, which is,
Yeah,
I guess it's like a little different, right?
yeah.
So I'm just wondering whether you guys have any connections to anyone in the press space to send this to. The other thought I had was, so Columbia School Social Work has the Center for Poverty and Social Policy,
Mhm.
and they put out all the poverty reports. They have data that they collect, but this would be something, it's right here, right? It's the community. So it would be, I wonder, and I know I'm an affiliate there, so I can connect if that's useful.
Yeah.
Also, there's the CUNY Center for, it's more about an equality study, but that would also potentially be of interest to them. And they all have press connections
Sure,
too.
yeah, I think that would all be.
Okay,
Yeah,
That's why we
honestly,
did
if
it.
anybody has any press connections whatsoever, I feel like feel
Yeah.
free to like reach out.
Yeah.
I'll probably send out an email in the coming days,
Okay.
sort of explaining like what next steps might look like and inviting folks to share any resources that they might have.
I have one or two. To also follow up on Leonard's point, I'm wondering,
Mm.
being academic, if there's some kind of policy paper that can be fully developed from the work that was done. I remember doing similar work many decades ago,
Mhm.
and the mayor looked at some policies work I was doing around Medicaid managed care at the time. The mayor looked at it, the city looked at it, and they actually looked at implementation, so this is something that's quite implementable. And in terms of policy impacts, I'm just wondering, and maybe that's, once again, not a conversation to have now, but to just like stay on top of it.
Yeah.
So that we, our community benefits from it, because,
Yeah.
you know, it's long overdue.
Definitely, and I think it's gonna be a whole sort of push, so I think. And I think it'll be, well, this will be more discussion for the meeting itself about like, you know. Academic journal versus like press push versus white paper versus.
or all of those things,
all of
right?
the
They can
above.
all have
The
that.
one thing
They'd be
with
formatted.
academic is.
Right, of course.
Yeah, and this is just like a personal thing, with academic, I think that if you do academic publication, it can sometimes close off some of those other opportunities to publish
Right.
because.
It
The
becomes
information,
embargoed.
the data and conclusions can be
Yeah.
sort of paywall.
Yeah, yeah.
Oh.
And you're not allowed, right,
Yeah,
if you get
exactly.
something, if you submit something, but it can be,
Yeah.
often a policy brief can be created out of a paper for publication
Yeah.
that is completely separate, even though it's obviously
Yeah.
the same.
Yeah.
But
Very
that's all.
thoughtful.
You
I'm happy.
You know, the other thing is, we've been getting more notifications now on city planning commission meetings. Has someone, well, I don't know, so, yeah, let me just finish asking the question. Has someone taken hold of it, mentioned to you, maybe they've mentioned to Victor about presenting it at the city, next meeting where 1727 comes up? Because it's almost in direct response, specific response to that, even though this has been a question and an issue for a number of years. Are you aware of?
Nobody's spoken to me about
Yeah,
that, but I can.
But we are getting, you know, from youth and, the office, information on hearings that are, and the dates of those.
Mhm.
So before, not that we need to close out, I know the fiscal year ends the month of June. So I don't know, it'd be great if someone can figure out that public hearing schedule. The, residents in the broader community have really been behind, pushing against this
Yeah.
effort. And so this information supports what they have been doing and saying as well. I'm pretty sure Victor's probably been in touch with those various, homeowners and other residential groups.
Yeah, but that was, yeah, so, but yeah, for that, we're gonna send out information about the meetings, opportunities to get involved in the coming weeks if anybody's interested.
So we don't have a whole lot of time, but you know, you'll give us a good heads up, right?
Yeah, plenty of time.
Okay,
But yeah, so that's that on,
well done.
the
Thank you.
community fellow.
Yeah, the New York State Health.
No specific updates on the New York Health Act, other than I believe that somebody from sort of the coalition that's working on the New York Health Act might present at the senior fair coming up on Friday.
On Friday.
Yeah.
And we should, those of us who can be there, I know I'm planning on being there because I have, Walter invited someone from my organization to
Yeah.
speak. And if any others of us, I know it's during the workday, it's from 11 to 3 or is it 11 to 4?
I might be able to stop it for a little
I
bit.
think it's 11 to.
On what day?
actually,
Just wanna get-
Friday. It's a seniors group, senior action committee
We can
resources,
double check that and
11 to 3.
circle back when we find out.
There's a flyer on the.
Okay.
I don't know.
That's another thing we have to circle back, but I'm sure it's 11 to 3, it might, and if it's 11 to 4, great.
I'll pull it up and I'll.
It's
I'll-
probably about 3.
Oh, it starts 11,
But
okay, so we got it.
yeah. Well, yeah, so the main thing that I wanted to talk about was, folks may or may not be familiar with, a campaign called, No More 24, it's the Ain't I a Woman campaign that's in support of a bill called No More 24. And so essentially, you know, home care workers have been working 24-hour shifts, in New York City, which is
Safe.
aside from
That was
unsafe and, you know.
Theoretically
potentially
illegal.
Like incredibly unethical, incredibly immoral, 24-hour shifts.
I thought that was done away with.
Even
but I
medical
was
students.
I think a lot of people thought that.
I
was
know,
done.
I think there's some weird.
I think we invited a couple of guests, folks that are allies of the No More 24 campaign, but involved in this work, to come and chat with us a little bit about, you know, what this campaign is, why this situation is so unfortunate, dire. And, you know, I think some of the steps that some of the home care workers have actually had to take to advance the legislation, banning these 24-hour workdays. So yeah, go for it and introduce yourselves.
Hi, I'm Sabina.
And
Okay.
let me say, you may
Oh,
really have to speak
Okay.
up, not because we're in this small room, but because
Right.
we get interrupted by the train. I can hear you. And, it interferes with people on,
we can just.
Yeah.
no, yeah, that's, yeah, speak.
Hi, I'm Sabina. I'm part of Youth Against Sweatshops. And also United Women Campaign, which leads with the Home Care Workers League to end the 24-hour workday. And I'm here with,
Hi, I'm Reverend Nozomi Ikuda. The social justice minister at Grace Congregational Church of Harlem,
Oh,
and very glad to be here.
139th Street?
Yes,
yeah, so.
Welcome.
Thank you. Yeah, so the home care workers right now, are fighting to pass the No More 24 Act, which is Intro 303, presented by, City Council Member Chris Marte. The bill essentially is to end the 24-hour workday and split the shifts to 2 12-hour shifts. And it's like really important because home care workers are working 24-hour shifts. Sometimes 3 to 4 days consecutively, even 7 days consecutively. Only getting paid for 13 hours. Due to, you know, agencies saying you get 3 hours of meal break and 8 hours of interrupted sleep. However, home care workers have testified, have spoken out that they do not get sleep. They're always on the clock every hour attending to their patients. And these are elderly immigrant women of color who are mainly in this work field who, due to the impacts of working 24 hours, have health problems that are chronic, very debilitating. Many need mobility aids, have had surgeries in their backs, their knees, their hands. Some of them, even now as retired, need home care. And so this is a fight that's been going on for a decade. And this bill has also been up in the air for quite a long time. For years ago, Christopher Marte introduced the bill and never came to a vote by Speaker Adrian Adams. This time around, though, Speaker Julie Menon has promised and has publicly come out to the sit-in that the home care workers had started back in March for a month and said that she is in support of the bill unchanged, which would simply just end the shifts and split it into 2. And then recently, home care workers have had to escalate the push to the demand by, they waged a week hunger strike in front of City Hall. And yes, recently, the coalition was able to meet with representatives of Julie Menin, and she promised to submit the bill to vote May 15th. Right now, unfortunately, one of our pushbacks is with Mayor Mamdani. He is trying to delay the bill or change the language of the bill, unfortunately. So he wants the wording of consent to be added to the bill, as in home care workers can still consent to working 24 hours. However, home care workers say no one can really consent to working 24 hours. Many of them in the past who have tried to, forego working 24 hours for shorter, have been met with no work or have been coerced to accept 24 hours. And, given the state of, our society, people need to pay rent, need to pay for healthcare. There is no real consent to working 24-hour shifts. Home care workers this is their second hunger strike that they did. They did it back in 2023 for 5 days. Yes, and this time around they did it again. For now, it's on pause based on how it goes May 15th.
What's May 15th?
May 15th is the day for the bill to go to vote.
In the committee or
In
in
city
the council?
council.
So it's out of committee and it's gonna get
Yes,
a vote.
so May 6th
Okay,
is technically the day to submit, so I guess it's
Oh.
our rally.
okay.
During the sit-in, our demands were to Julie Menin to not delay it. But given our meeting and her promise, we're now calling on to Zoran Mamdani to keep his promise, because during his campaign, he actually spoke at one of our rallies. In promising to end the 24-hour workday, only to try to change the nature of its bill. He actually, on the days that we were there on the hunger strike, he was at City Hall, but he hasn't come out to speak to the workers in any capacity. Yes.
Do we have that in our packet or no?
I can send that out to everyone.
Yes. So
You have it handy now?
It's not.
It's a digital, it's not,
No, but where we can look
Yeah.
at it now.
I can email it to everybody, right?
Yeah,
Yes.
Cameron's going to email it, and I hope everyone online, on Zoom can see what's there. There's a QR code.
And so the vote is on the 15th.
on the 15th,
In the
yes.
city council.
Yes.
And so all of these people that are listed, well, I'm looking at my computer, it looks like a bunch of city council people are on with.
Yeah, so we have 18 city council members have signed on it.
Okay.
A lot of it has been through efforts through phone banking, everyone calling their own city council members, us urging folks who support the campaign to call their city council members. But now it's Speaker Julie Menin has actually presented the bill to the mayor's office, which is not really something that's normally done. Usually it's just something that the speaker just submits it and then it's put into vote. But due to, the mayor's office trying to show that we want the bill to be
As it is.
Yes.
Have
Yes.
any elected officials in this community board signed on?
So yes,
Looks
so
like
actually,
Abreu.
yeah,
Mhm.
so.
He did? Yeah.
So,
It
yeah,
looks like
so-
it.
I didn't hear that.
Abreu, Sean Abreu?
Sean, okay.
Yes.
So good.
City council
And
member
Yusuf Salon.
Yusuf Salon has recently signed on to the bill.
Yeah.
Yes. And we also have support from Assemblyman Ron Kim, Senator Jessica Ramos, they've been really big on also supporting the home care workers by wage theft, which is, how the system persists. They're working 24 hours, but they're only getting paid for 13. Under that assumption that I said before, that they get 3-hour meal break and 8 hours of interrupted sleep.
That seems so illegal.
Could I just
Yes.
add,
It could be.
if I could just add a couple points, one, obviously the primary focus here is on the workers. but also consider the patients, right? Because, you know, a lot of people who are authorized for home health care just get a few hours. Imagine what the condition you have to be in order to be authorized for 24-hour care. So these are folks with pretty advanced and serious conditions that have been considered to be warrant 24-hour care. And now they're getting 24-hour care from people who are exhausted. So it's really, I mean, again, primarily a workers' rights issue,
Yeah.
but there's also patient care
Yes, and we have,
aspect to this. And then, I mean, so much about this as I was learning about it was just so incredible to me. But the other thing is, so the pushback is, it would be too expensive to pay them, right? But New York City is the only part of New York State where this is happening. Somehow they're finding the money to pay workers the split shift, 12 and 12, in the rest of New York State.
Yeah,
But
so.
for some reason in New York City, the workers and the patients are not being given the split shift. Now, you can parse that with any kind of theory you want, but it doesn't look good. I mean, it looks really bad to me.
Even with our coalition members upstate, like in Buffalo and Syracuse, yeah, they have 12-hour split shifts, sometimes even 8-hour, split into 3.
Of course,
Yes,
I'm a 24 hours, because I've got some healthcare that's taking care of family members.
yes.
And they definitely want to be paid any hour they work, absolutely, there's no doubt about that. But some of them like the 24 because they're afraid of commuting at night. In other words, if you work 10 AM to 10 PM or 8 AM to 8 PM, they're getting out, and they've expressed that to me. I've asked them about this campaign, because I'm aware of it. I actually saw Cameron down there
Yeah.
the other day. Would they be allowed, if they wanted to, if they do a double shift, so they don't have to commute?
Yeah, so,
That's the thing they expressed to me.
yeah, so yes,
So is that the
And they
consent
probably
piece?
have to
So,
sign
well,
something.
with our main issue with the consenting language would just mean that the current system as it is right now, where 24-hour shifts exist, will still persist, and agencies can use that wording as a way to continue
Right,
pushing
right.
on 24-hour shifts, but just simply ending the 12-hour shift, just saying it's illegal, doesn't negate that, someone.
So people can
could
still do
do
what
a
they want.
24-hour shift, yes, but
So
just
they-
the,
They'll have the option.
yes,
It's like-
the wording,
work 2 shifts in a row.
yeah, but
it's
the wording.
analogous to doing like having a minimum wage law, but then saying that workers can
You say,
consent
I
to
prefer.
work for less than minimum wage.
Yeah,
Every
We
corporation
need
will
paid for everything.
will
up
pay
their
less
salary,
than
that's
minimum
it.
wage if there's
The issue.
alleged consent.
Yes,
But if you, abolish the 24 hours, 12-hour shifts are still available. Folks get the option to pick up multiple shifts if they want, but there's no implicit requirement that anybody works 24 hours.
and the bill, its nature is to legitimize the fact that, these women are working the full 24-hour shift,
Mhm.
not just 13.
Yeah, because I think that was the point that we want to emphasize is that they are working 24-hour shifts, but even in that, they are only being paid for 13 of those
That's the
24
big
hours.
problem. That is a major
Yes,
no no.
and many have
Once they're getting paid for
ongoing
24.
cases. We even went to the Supreme Court because Governor Hochul, as well, she is also one of our biggest pushbacks. Because, yeah, she, with the Department of Labor, many of the cases in the past were dropped without any warrant. We actually went to the court, and the court found that the Department of Labor, did wrong. They unlawfully, closed cases, and, which is one of our rallies that we had at the front of the Department of Labor, where, during Mamdani's campaign, he had come to us to do it, so, it's a pretty,
So
really serious issue to us.
can we write a letter of support, or is it not
Yeah,
enough
we can
time?
absolutely, we can.
Because it's May 15th is the vote. Is that too late?
I
Too
think-
early?
The resolution is stronger.
I think we can definitely put together a resolution.
Before.
I will start working on one right now and
Okay,
we'll see
I'm
if we
happy
have it by the end of the meeting.
Wow.
No, we'll-
How do you do that, Karen?
Put something together.
Well, they give
like
us
help me with
some,
Man can write.
having done
Yeah,
it,
we have
a number of
some- we
us
have
have
some
done it.
You have
Yeah.
template.
Yeah,
And actually, there, any of us, there's some issue you feel strongly about, there's probably something going on. If you know about it, look it up, we'll get the data. And then, you present it, but,
Any
get
other
help on it.
Thank you for your work.
Or anything else y'all wanted to share?
You know, I just wanted to comment that
I don't
Is
see
it-
any hands up. Okay,
the workers are really not thrilled with the mayor at this moment, but I really feel like this is his opportunity to really define the direction of his administration and his future legacy. So, I really feel like encouraging him to do the right thing, even though it's uncomfortable right now, will actually be a benefit overall. So
So we should also be calling his office.
Yeah, I mean, he talks about affordability. I mean, people should get paid. And
Well, he also cares about workers, right? Remember,
And that-
he did a hunger strike for the
Yeah.
taxi drivers, remember?
Yeah,
That was his
but
big
he's
thing.
freaking out because of the $14 billion deficit.
Yes,
Yeah.
but he's not paying these people. Well, I mean, I guess a lot of it's Medicaid.
what are points that are in opposition to it?
Sorry.
Yeah, who,
Or hesitancy, I should say, they may not be up, maybe it's timing, is it, what do you know in terms
Well,
of?
they mainly save money is the issue. However, like I mentioned, by stealing their wages, agencies and private insurance companies are able to still profit. Former Comptroller, Rand Anderson, he made a report of, including some of the agencies, the biggest wage theft, post on leave workers who has made like $53 billion in profit. It's not a money issue, given the fact that there are agencies right now, given, how the home care workers and the building this movement have already voluntarily started getting split shifts.
Yeah.
It's only right now, the really big agencies, union agencies like CPC, Chinese American Planning Council, United Jewish Council, who are giving, pushback on the consent language as well.
Really?
Yes.
they're pushing back.
Yeah, like on the.
on the,
passage of
against the consent,
yes,
so
okay.
they're for the bill.
No, they're against the bill in its original, in its current nature of, just simply saying ending 24-hour shifts. They want to add the
I
consent.
see, I see.
Yes.
And what's the reason again, say that latter part?
They say it's a money issue, but it's.
Well, they want, it is, because they want to keep the money.
Yeah, they want to keep money, but it's not funding, it's not a
Got
funding
that.
issue where it's like, there is no money in order to be able to, provide split shifts in order to fully pay these workers.
They're making money upstate.
Yeah, I think the
on
status quo is that the current situation, this has been propped up on like fundamentally like wage theft.
On the backs of these
Like it's, the system is solvent because of the wage theft. And so if abolishing the system requires like additional inputs of funding for some of these agencies to like make a little bit less profit, or the insurance agencies to make a little less profit, obviously they're not gonna like that, but, it's ultimately necessary to make sure that these folks are paid what they deserve.
Are these workers providing services for people who have Medicaid or Medicare?
Yes.
Is that what the issue is?
Yes.
Because of.
So
who they're
there are some
paying is-
agencies,
It's
do
a
get,
Medicaid
yes.
report. Okay, thank you.
Yeah.
So that's the issue.
Yeah, you're right. Especially
Yeah.
since they're gonna be cutting those
Yes,
services, right?
Uh-huh.
Then that means cutting
Yeah,
Medicaid.
yeah, that's why.
That's
So
that
what,
makes sense.
yeah, so it becomes a little, well, only tricky from that standpoint, but I don't see why they can't.
Because
do-
because
cut
Medicaid
that
is
12
cut,
hours.
so, you know.
So I'm not an expert in this, but
Right.
my understanding, is that, like, so I have Medicare and I'm on an Advantage program.
Uh-huh.
Original Medicare's, I'd love to do that anyway. So a lot of us who have dealt with that, we're on Medicare, but we deal with an insurance company too. Medicaid works the same way, right? So people on Medicaid often have an insurance company that is their broker. So just because it's Medicaid or Medicare doesn't mean that there's still insurance companies that are involved.
But the federal government,
Say that again, Heather.
I said, but the federal government gives money to the state to fund Medicaid. That's a federal program and they're cutting that.
Yeah,
So
absolutely.
there's no funding in the
And
state.
so Governor Holco supposedly was
She has
joining
no
with-
money.
well, she had talked about joining, putting something together as they have in California with several other states. I don't know where that is. You know, we have to follow up on, have a follow up
Working on
on that.
To it, Cameron.
It's a mess. It's, yeah.
Because it, you know,
We're caught in the middle, I mean, that's terrible, those shouldn't be, not on the backs of workers, this is the problem with the country right now. It's the
Right.
people who are, you know.
because they should be able to work 12 hours and then if they take a break, let
they
someone else come
absolutely
in.
should. They
The other 12 hours, and
absolutely
then if
should,
that
but
person wants to go back, the 12 hours, there's still that opportunity to get
all these
rest. It seems like there's a way
contracts of
for this to be
marginalized
worked
people
out.
is not
Yeah,
payable
no matter what, you know, the issue itself, you know, working 24-hour shifts
Yeah, that's,
consecutively,
I
it's,
just
you know,
wanted to.
it's a violent, you know, sexist, you know, these are women.
Do they go home?
No,
Or they're working on,
No.
yeah, and yeah, so a lot of them, you know, they stay there and sometimes even
Yeah.
have to, even with like replacements coming, sometimes they even have to stay until the
Until
replacement comes,
replacement
they
comes.
can't leave.
Yeah.
So that's how they're sometimes,
Exactly.
you know,
yeah,
they're trapped,
That's
yes, you know,
right.
and you know, they miss time, you know, recently, you know, back in February, we had a 4-hour hearing with the speaker, or, and then back in 2022,
That's
it was a
a
9-hour
body-based
hearing.
labor.
No, and they say, you know, how they lost time, lost their health,
Work with no,
you know.
it's like, well, it's live-in,
not.
not.
Laquita, it's Monica. I just, Legal Aid has been on the front line suing legally. So I just sent you a press release.
Monica, hold on, can you hear?
I can hear
Hold
you.
on one sec, yeah, hold on, because Reverend, Nazama was talking.
Well, they're still maintaining their own residences. They're not
Uh-huh.
moving.
Yeah, they still go back to their own residence.
So they're still paying rent
Mhm.
someplace else.
Mhm.
They don't have the benefit of like free housing or something as live-ins.
Yeah.
Okay, and then on Zoom, we have Edwin and then
Well, I don't
Monica.
know if Monica, oh, okay, Edwin was before my,
Yeah.
okay. Hold tight.
I
Edwin,
mean, I think that we have to call this what it is. It's modern day slavery. You know, we can go around and say all these things, but the reality is that who goes to work and because you're sitting idle, you don't get paid for that. This is the premise that has been used for these workers is that, well, if you work 24 hours, we're assuming that the patient is going to be sleeping for 8 hours. I'll tell you this, man. Look, you know, I've been a nurse for so many years, and you guys know, you know, the work that I do. This is just a scam for these workers. Patients, they do not go to sleep at night, and many of these patients that require 24-hour care, you know, those folks who are there 24 hours, they don't get to sleep. And, you know, we shouldn't be exploiting these folks who care deeply about this job and who are doing a job that many of us would not do. They should be compensated. And they are getting paid many times minimum wage to do this work. And yet, on top of that, they don't get paid 8 hours. I don't even know why this is a point of contention, but here we are in this modern day economy where we, you know, use all these fancy words to, you know, sort of, you know, allow slavery to take place in our own backyard.
yeah.
It also seems really dangerous for the vulnerable patients.
Horrible.
And
Monica,
then Monica,
go for it.
Okay, so I just sent you the press release that Legal Aid did because Legal Aid has been suing on the issue, and I think it just gives a really good background on the legal aspects of what's going on here.
you dropped it in the chat, Monica?
No, I didn't. I emailed it to you, Laquita.
Monica, can you share on CB9 Connect so we can share with the wider community?
I don't know. I can send it to CB9 on WhatsApp. You can.
Okay, thank you.
Yeah, I'll do that. I'll do
I
that.
think there's actually a little bit of contention with legal aid
Yes,
on this.
so a lot of legal aid lawyers, you know, help are on the cases of the home care workers fighting for wage theft. So these are people, legal aid, lawyers that represent the home care workers and fighting wage theft who, this bill will, strengthen their cases, legitimizing the fact that they are working the full 24 hours. However, legal aid is, opposing the bill.
Why?
Why?
Yes, I wanted to know the whys with all of that.
Monica, do you know about that?
No, that's not necessarily true. That's why I'm sending out this press release. The problem is that people are not being paid for the 24 hours. And legal aid, I wouldn't say legal aid opposes it. We want it to be clarifying because we have so many of these wage theft cases. So I would not say that legal aid opposes the bill. That's why I'm sending this to you. Edwin, I'm sending it to CB9.
Thank you.
I'm forwarding right now. 1, 2, 3, 4, 5.
I think it would be great if legal aid would come out with a statement saying that.
Legal aid has said a statement. That's what this press release is about. We've been working on it. If you want someone from legal aid to come speak on the issue, I can get someone for you to come and speak on the issue.
That'd be great.
That's why I sent out the press release.
Yeah.
So you all should have what Monica sent to me. I just emailed to everyone here. I'm sorry, didn't have your email address, but if,
Well, we send in so you can, we can also find it.
why don't you just
Most likely have.
type in your name right now? Let me see.
But yeah, were there any other questions, comments? It's I think this is like an example of like legislation where I think that there would be some implementation costs associated. But I think the status quo is like so fundamentally like immoral, that I think, New York State has enough money to fund, the gas.
You have to pay for all that while you're there.
Yeah.
And if I may, Cameron, basically if we look at that argument of saying, well, they're sleeping because they're sitting idling, are we saying the same thing for a security guy that works overnight and doesn't have anybody showing up at the door? Are we saying the same thing for any of us who sit at work whenever, it's raining or there's snow? This is just, if you look at the demographic of these folks who are doing the homework, they tend to be immigrants, they tend to be people and guys too, who are non-English speakers, who they don't have the political capital to go out and advocate for themselves on this. And, I commend the group that is helping them get together on this. But this is not acceptable anywhere. Look, is anybody going after the construction guys that you see 7 of them standing and there's only 1 of them who is actually, moving things around? This is horrible.
Horrible. Yeah.
Yeah, here's the problem. The problem is that state legislation does not deal with the underlying state laws that created the 24-hour leave-in shift system. That's the problem. So, I understand what the city's trying to do, and I think legal aid is going to keep suing because people aren't being paid. But we really need to push the changes at the state level. Even if there's a change at the city level, this is funded by state funds. So we really need to be focusing on changing the legislation at the state level.
Passed at the city level.
Which other legislators have you sent to? Have you sent to? I heard you mention a couple assembly persons. Jordan Wright. He's at least in this area. Assemblyman Jordan Wright, Assemblyman Al Taylor.
Cordell.
Michael Lasher, is he a city council or?
And I was
assembly?
thinking of,
Assembly, he's 69,
Assembly.
yeah.
I was
Yeah,
thinking of
Michael
Cordell Claire, cause she is the
Oh,
committee
Senator
chair. of
Excellent. But,
Adrian or
and with,
something.
yeah, Senator
We
Cordell Claire.
do have a list of all of the elected officials, current and former.
But they're very strong, and since you've come to us, I think,
Yeah, so.
our
you know,
recommendation that they be.
Well, we could send the reso to everyone.
Yeah.
Is that true?
And I think to the point of like sort of city versus state, I think that is, I think I'll say that that's like a strategy question for, you know, sort of the coalition and, you know, the No More 24 and the A9 Women Campaign. I think we, as a community board, have the ability to say like, yes, and. We can say
Absolutely,
both.
this is, the vote
We
is
can
the
write a
15th,
Yeah,
you
we
need to
can-
vote.
I don't think we're
At the
saying-
city level and at the state level.
Yeah, so.
Yeah, I don't think we're
we can
opposing that. I
mobilize,
think we're
you
just
know,
adding.
Multiple ways that we, you know,
Good pressure.
put pressure. We've met with the United Nations, recently they just sent their report on it, to the US government, Marco Rubio, you know, they have 60 days to respond.
Sure, that'll be.
The report will be public mid-July,
He's on it.
mid-June, mid-July.
Yeah.
Marco Rubio, the Secretary of State.
Oh.
Yeah, so, mid.
Yeah.
You know, we've gone to Albany to push on it, to be more state.
You know,
It
it
seems
seems,
strong
Oh.
and, just this one point,
Mhm.
Manhattan Borough President, when I heard how he was able to push all these bills through.
Yeah,
It's
we
kind of like,
definitely,
yeah, I think
definitely
he
been
would,
pushing on, you know, county, or city council members. to
Brad
prevent
Coleman,
state
Siegel.
representatives.
Mhm.
For assembly members, I had mentioned Ron Kim, he's been really pushing hard on it as well, Stephen Raga, Grace Lee, Marcella, sorry, I can't pronounce the last name, Marcella Nitanes, yes. We will have some committee members like Ben Yee, Whaley Tong, district leaders, like Richard Corman, Victoria Ferrero, Leila, Jasmine, and then, former, council members, former assembly members like Richard Godfrey.
oh, yeah.
So I think.
Can you send that?
Yeah, so I can also send this list to Pam, and then also all the other, organizations, local, borough, organizations that, you know, have support the campaign as well.
Okay.
Assuming this gets passed and the shifts get split into 12-hour shifts, how much would that cost? The opponents all say it's a funding issue, so what are those numbers?
So no one.
Yeah, that's what I'm trying to
Well,
get
in the talks, they don't really give us that,
Seems like the closest thing would be what Heather stated about the Medicaid.
and talk, from what we know from Chris and, his discussions with the council member.
How
all
many
the
shifts are there? Cause just take the number of shifts, double it. Or take the amount of money they're spending currently in New York City. A little less than double it, and you'd get the number.
Right.
Because
There's
it would go
a
from,
couple of different analyses.
Yeah.
And I think one would say that, the cost to the state would be about, $200 million. But I think to the point, like New York State's budget is like $100 and something billion. Like if this is,
So it'd be in, I
would
would say
it be more
potential.
or less?
I think that the other aspect that we're not speaking about is
Hold on, Edwin. Hold on 1 second, Edwin. Jordan?
Would it be more or less than 0.1% of New York State's budget?
let's find out.
Yeah.
About what is this, 0.1%? Yeah.
Cause
So-
there was my wife is always trying to get me to chill out about money, but she said that if your net worth, if any expense is less than 0.1% of your net worth, why are you worrying about it? So I guess that would be my question.
You're right.
Why does New York State care?
Very,
They're not making it a priority, and right now, and I'm sorry, I know Edwin wanted to speak, but right now, I mean, they haven't passed the budget yet, it's over a month due. Who knows what they're,
That's probably costing them more in
Yeah.
nonsense and interest payments.
Exactly.
Yes.
I mean, it seems advantageous to try to do something now because the budget hasn't been finalized. But then at the same time, I wonder what they're focusing on that they can't pass
we're
the
kind of in
budget.
an anti-labor environment.
Yes.
Edwin?
I was gonna say, Laquita, that the other, you know, damage to this is that you're gonna have less and less people wanting to go into this field as our senior population is projected to continue to grow. And that is also an unintended consequence from keeping this, you know, job suppressed with the current tactic, because people are leaving, you know, home healthcare. You can go and work at Target and make more money and probably have better condition.
I mean, yeah, you're not gonna work 24 hours at a time.
That's right.
Well, and not only that, as I think about it,
And you get paid more.
government not wanting to care or sponsor research on cancer and other ailments that people get. And they could, you know, they may be younger, not necessarily everybody's aging, but I know you mean with the age population.
Yeah.
But people may start getting sicker with what they're cutting in other ways, and there'll be even fewer people to do home care who need it. So it's not only an age issue, which it is, but it's a health. It's basically health.
You mean measles outbreaks cause long-term health?
Yeah, everything's going. You know,
No.
no, it's not a good
So-
situation.
Yeah, I mean, this wasn't on
Got it.
on our radar, so this is
Thanks
more,
for bringing it to. the
more
attention.
stuff to be concerned.
So are you
about.
finished with the resolution? Kim?
Yeah, so
Time we get to like the end of the meeting, once we cover the next several things, I'll have some.
Well, what we could do now is vote what our desire, even though we kind of know it, but formally
Seconded.
vote. Let me get it out. Formally vote on being impressed with the presentation, as well as deeply concerned about the issue at hand, where there is a bill that's, do we have a number and?
yeah, it's interpreter,
Intro 303.
no more 20.
And there's a common consent to want to support laborers. In this case, very specifically, home care workers. Or is it beyond that, those work in hospitals also, or just generally?
So this bill
home
is
care.
for home care workers.
Or just home care.
You know, it would show that, you know, if we allow the 24-hour to persist and, you know, we give excuses to allow, you know, this practice to persist, you know, this is something that can, you know, be put onto other industries to say that, you know, if one worker can work 24-hour, then another worker. can
Right,
work
well, they
24
have child labor than that.
I was gonna say,
So do you?
the child labor law,
Right.
maybe before we have
There
those
could be
laws.
some,
they
yeah, I
do
don't know if
that.
you wanna make references, but at least we're being consistent. So that's a general motion, but that's a general motion that I just made in accepting,
Okay.
to respond in the form of a resolution
Yeah, I
to,
mean,
in support of Bill 303,
we
home care.
can do that, but I can also just, before we adjourn, I'll have a resolution for it.
I have to leave at 8, but I do vote.
Yeah, but we can just say, agree that we are preparing a
Okay, yeah.
resolution, we can give recognition to that.
Unanimous consent,
Seconded.
Okay,
abstain? Second?
Me?
Yeah.
Yeah.
Okay.
which one? Do you
Sorry,
agree?
sorry, Mr. Chief, what?
Did
Yeah.
you?
Okay, sweet, all right.
Yeah.
Yeah, we'll work on
Yeah.
that.
Okay, well, yeah,
Question
so,
answered.
you know, May 15th,
Yeah.
home care workers will have to be out
We'll
there.
send this out there.
In a city hall at noon, to see what, you know, the outcome is like. If it passes, it'll be a huge celebration. You know, this has been, like I said, a decade long fight.
Mm.
Home care workers, second hunger strike,
Yeah.
organizations from, you know, related to healthcare, like NHP, you know, anti-displacement groups, because the home care workers also lead a fight against, you know, anti-displacement in Chinatown. From youth groups, you know, more city council members, elected officials have really, you know, come out, shown support. However, if the bill unfortunately does not get passed, home care workers are set to do the hunger strike. Yes,
Now, let me just ask you again, it's supposed to be voted on May 15th?
yes,
Let me just say that Cameron is working on this now, possibly to have a great draft of this. Inside the committee, he will email the committee members and then our chair and executive committee. That committee meets on May 14th, which is the following Thursday. So hopefully everyone will have it, and the executive committee does have the power to do an advance in place of a general board vote. So that means it could go out, be ready, the labels could be ready, not labels for mailing, but email could be ready to go out the night of, right after the executive committee. Go out that night, because if they're gonna vote whatever time on Friday, at least they'll see it.
But our
in
council
advance.
members are on board, so this would just be like an additional, be like, hey, don't change your mind, use this one.
No, I think
Yeah,
right,
right.
he did say yes so far. And then hopefully we'll, yes, city council, that's it, but we know other people on city council also.
But yeah, thank you so much.
Thank you for inviting me.
Yes,
Thank you for your
time.
space.
Keep up the great fight. We all have these fights and we can't be everywhere, so thank you for being there.
Yeah, thank you for
Yeah.
bringing light to this issue.
Mhm.
You put your emails down.
Yes.
All right, I'll take them and I'll,
And do you also have your mom's email?
yes, I believe so, yeah.
Yes.
Yeah, we're on signal, so.
Yes, I
We'll
thought
check.
so, yeah.
Yeah.
Very
I'll
good.
need to signal.
All right, thank you so much.
Thank you so much again.
Thank you.
Thank you. And don't be a stranger after this. We want you to come back. Keep us informed of other things that are happening as well as, supporting us in some of our other endeavors as well.
That was my first.
But I just,
Hopefully it'll be a last.
No.
Thank you.
Yeah.
And Grace is a wonderful church. Yeah.
I will give Pastor Brewster with us.
Yes, yes.
Thank you.
Okay. So we're just about done. I want to mention, the Public Health Forum. And everyone was there. Cameron wasn't there.
I was
He was
there,
on agenda.
just got there like late, I got there,
You were there?
so I said hi. Okay, don't
Yeah,
worry.
you went to, in the back of the room.
Okay, I'm sure.
Told me to show up at 3, I showed up at 3, y'all were already working on that, just joking.
Oh, well, shit. Okay, that's, all right, thank you, Cameron. Okay, so, we've had a couple of debriefing meetings relative to, the Public Health Forum. And I have to admit, I've gotten a lot of, feedback and, that it was really outstanding. And that when I think what they're saying is, for the most part, not only the audience, but the professionals who spoke, the information they gave, we had such quality presenters. And the location actually wasn't bad at all. I was a little worried about that, but technically, I think it really was good. I want to thank this committee because everyone participated, everyone showed up and, had something you could offer. I knew because you told me most of you worked during the day, so the daytime wasn't available for you to come in, but you really chipped in. And just made it very special there. And this was his first stop. I'm saying it, I don't know if it's totally true, but his first public engagement with the community was extra special for a lot of people. And not only did he come, but the Manhattan Borough President came. And it's not like we promised them a huge audience, but they came because the subject matter, they want to be involved with the community. They want to know what's happening, how engaged is the community with our effort. One of the, so I applaud this group, and I applaud also our community representatives from the healthcare and wellness environment. CUNY School of Medicine, particularly the community center, really showed up and showed out for us. They funded just about the entire event, helping to pay for whatever was involved with the location. The same with Tall Omega, with this youth workshop, with food. Actually, I think even in that regard, I believe giving credit where credit is due. The community center really put forth a valiant support in terms of that as well, providing the food, making sure that our location, the logistics were there for us. And that meant, well, Anthony responded quickly when we were not getting a response from him directly. Victor put a call in, and Anthony called right away. So we, he and Victor have that tightness and respect. And Anthony's just, started working on our behalf and making everything related to logistics possible. And Tall Omega with this youth workshop worked closely with CUNY, the community center, to get its psychologists and social workers on board, ready to work with the young people. There were a couple that showed up, but in all fairness, we were getting out notices to the schools, and there was not as much outreach as in particularly in person outreach with the schools that we needed to have. Yes, Cameron.
This is not related, Katrina just chatted and asked to confirm she's on the agenda to speak.
Oh my goodness, yes, you are on the agenda, and thank you, Patriana. I'm not gonna be long. Let me just say, give me about 10 minutes. Okay? So sorry.
Yeah, no, it's okay. It's okay. I just wanted to make sure because I heard you said that we're wrapping up, and I said, wait a minute.
Right. And she was there also. So we have the list somewhere. I brought the list to the general board meeting. Now we gotta find out where that is because I left it on the table. It's somewhere among the papers. But we have a number of people. I found out we had a count of 40 in terms of altogether, but there were a number of people who showed up who didn't sign, like our friend Patriana. And there are a number of others who, didn't sign up. Always you want to push for more, but that work has to come, with just being in person. Young people are a special market, and depending on how we reach out to them, that's how they get attracted. So we've looked in the debriefing at a number of things. And of course, going forward, they can, you could, I'll submit something, whatever comes out of that to this group. My priority now is that for me, it's not over. We still have some weeks to go and before this fiscal year is over. And my push is that all of the West Harlem Development Corporation people, who, especially when they work with us and they need to reach a particular number so that the fine work they do gets recognized and credited and they're on board for the next grant. And I think that's true with Tall Omega Charitable Trust Fund. We have an opportunity through Lois Penny, who lives in our district and runs the New York City for Youth program. And she is working with Cancer Kids First. They are having a 3-day conference, May 29th, 30th, and 31st. The Cancer Kids for First has been strong in reaching kids in the other boroughs, especially Queens, but not Manhattan. She has basically said no one, she said this in her group, none of you show up from Manhattan. So, you know, it's a tough group in a lot of ways, not only, well, Manhattan residents. So with our youth, we have to put out that special effort. She mentioned this opportunity because she called and was looking for space. And she had heard about the health forum and wanted City College. And so I'm talking to her, I'm saying, wait a minute, here's an opportunity for our youth workshop through Tall Omega to have another opportunity to reach young people. So I know we have I'm willing to go out to the schools. I know Wendy said hopefully Wendy, you're there and hopefully can, ready to make a comment as well. And so right away, Dr. Gomez, who was extremely instrumental with involving us in taking care of everything with the public health forum related, that was a financial consequence to us, said, let me put a call in at Columbia to a mutual colleague and friend of just about all of ours, and see if there's space at Columbia's Cancer Care Center. Well, Nicole got back to us before that day was out and said that she was interested in helping us answer these questions, and then I'll get this out right away. We feel that when she puts herself out, Nicole is very respected at Columbia, that they will listen and work to try to accommodate our request for space. And Columbia has so much great space because they do, of course, their lectures with the doctors, nurses, and specialists and special guests that come there. So we submitted the very next day following her note, got that information that she was putting it out to the powers that be inside. And we're hoping by Wednesday to hear from the Columbia University Irving Medical Center to see if we could have a 2-part presentation to young people that will be interactive, in person, with 12 to 2 being dedicated to the youth workshop Making It Through, that's sponsored by Tall Omega, and Wendy's almost at every committee meeting of ours, and supports us in a number of ways, and as well as she's a 3-year recipient of the West Harlem Development Corporation grant. The second part, 2 to 5, would be dedicated to Cancer Kids First, where those teams will be putting together packets that get delivered to hospitals. Right now, they know 2 of the hospitals, one being Mount Sinai, or was it NYU Langone? I think it's NYU Langone. And I forget, there's another one that she said started with a C. I don't know what the hospital is. Now, the young people who are helping are not themselves, to our knowledge, suffering from cancer, but it's a great project to give them awareness of classmates they might have or family members, or even if they are, to give them that hope and support as well. Is there anything, Wendy, I hope you're there. Wendy? Maybe she stepped away for a moment. Monique, do you want to add anything? Oh,
I'm
there
sorry.
she is.
Oh, here I am. I'm sorry, Laquita. I just want to say to everyone that I'm so thankful for the support that this community has provided to our Making It Through mental health program for young people. And the opportunity to work with New York City for Youth to provide another event to co-sponsor at the end of May. We will do whatever we need to do to ensure that it is a success. So I'm looking forward to continuing to work with all of the different organizations that we have met through working with this committee.
And I want to add that if you know someone connected to a youth oriented organization, like there's not only the Boys and Girls Clubs, there's Jack and Jill. 100 Black Men has the Junior 100. And they look for projects like these. It's just a matter of reaching their coordinators, their supervisors. And one of the biggest issues we had is that our event took place during school, the end of school break. You know, there were a lot of schools that were out. So that was to our disadvantage on that score. But that was the date that we could get with City College. Once Dr. Gomez came to us and said, we want to do this project, we have to get it out before a certain date. And so that was the farthest date available to us. The other was April 18th, and that was the last that it was taken. So I think we have a good shot at it. We have 4 high schools. The ages that will be involved, right now 13 to 18 is primarily high schoolers that Lois's group is working with. So if there are any of you, if you can leave May 30th available to help us out.
That's
that's a
Memorial Day
Saturday.
weekend.
Is it that weekend or is it 25th? Seems like the 25th
We
is
talked
when
about
they're
this.
celebrated.
I think that's not May
The
30th.
following weekend.
Yeah, I think it's the weekend.
Okay, after Memorial.
Memorial Day is what I saw. I thought was a
No, it's like
Tuesday.
25th.
Yeah,
May
Memorial Day
25th.
and after, I am no longer in New York.
Is what you telling me that you're not gonna be around anymore?
I'll be back in July.
Oh, well, you're coming back. Okay, okay. All right, so we'll miss you.
I'll be gone for a month.
Okay, okay. So, but then this is the date that Cancer Kids First had already set up, so that's it.
A question and a comment. The question about the second part today is just assembling kits for cancer patients, because I had to jump off earlier, so I was trying to get clarity.
I had to jump off too. Wendy, was there anything else today? After I jumped off, I know Dr. Gomez was speaking and you were still on the line and.
I think it was just to get the invitation together so that we could get it out, even though we may not have a specific space confirmed, so that we can start doing our outreach.
So right now, what they're doing, what the 2 organizations are doing with the youth workshops, they have their flyers that will be ready by this Wednesday. They just need to drop in the location.
Right.
I think we need to start making those calls and in-person meetings. Like I said, I'll be available to go around schools and make calls.
I just was trying to get clarity so that if I were to go and promote, I just wanted to be clear about what was happening that day. And then, so in the afternoon.
They have a runner show. I thought, okay, both organizations presented their runner show to Columbia. So I can email that out, except the reason I didn't send out, we pretty much know what Wendy's is, but Lois today supposedly the Cancer Kids First Project has started filling in with speakers. So I'm gonna see if hers can be ready by Wednesday. But of course, they have 3 weeks. Somebody may come in. I know how that is, last minute, some of the presenters.
Yeah, I get it. And
So
then,
hopefully this week we'll have that.
all right, the other thing was, in terms of just, I think we talked about using it as an opportunity to build on what happened at the Public Health Forum, having this event as a way to continue being out in the community and just letting people know what resources are available within, Community Board 9. So, because we talked about, we didn't reach as many people as we had hoped, though it was a good event. It's a way to keep the, story going, if you will. So I just wanted to add that. And yeah, I think this is a great opportunity, so. Yep, hopefully we can get it out ASAP.
And hopefully, I have to reach out to Shanika and Deirdre as well. I was kind of trying to make sure that we were on point. But it looks like the 3 days I feel hopeful about Columbia. Lois was able to get an okay from, the Harlem State Office Building. So there are 2 locations. I'm not sure if there will be a third, but it looks like the emphasis will be on that Saturday and Sunday. And even though, in some ways it's the tail end of celebrating a holiday, there are young people who will be coming also from other parts. And so this is the way they'll say they spent their end of their weekend, celebrating the Memorial Day. And I think that, the Memorial Weekend. So we'll keep everybody posted. It'll be via email so that hopefully, like I said, by Wednesday, you'll hear from us. And if you can put that time set that time aside, it would be 12 noon, which means we would want to set up probably 11:30. Be there earlier to 5:30. But Lois said the kids, they usually help, break things down if necessary. But I don't believe we'll have to do much unless there's like food on the floor, just the kind of crazy stuff that can sometimes happen that we could, should be mindful to take care of. So we'll be invited back.
Right. I know I won't be around, Laquita. I'm gonna be out of town,
Okay.
so, and that's.
But beforehand, if there's anything anyone can do, we'll send out email, hopefully hear from. Wendy, is there anything else that we can think of that should be added to this?
Oh, I think the promotion is the biggest piece for us. Because
I think
the event
think-
itself, I think, will take care of itself, but it's to get the bodies there, so it's the promotion.
Cause all the kids are not gonna be away. There'll be a lot still here in Manhattan
Yeah.
So you,
and other parts.
Yeah.
So it's just a matter, if we start now, like A. Philip Randolph gave us a start, and then with the other school on City College's campus, and, I think there are 4 high schools. Oh, we also were gonna reach out, Eagles Academy, and
Yeah.
there's several where.
versus.
I'm really more interested in, well, all the kids, but District 9, that we
Right.
can finally reach them. We have to really, I don't know that we've ever really reached them, but we have reached a number of teachers. I know the
Yeah.
youth committee has a lot of presentations that come in,
Correct.
but we gotta be able to get directly to the kids some way. So that's important. So now, that's it. And I wanna add, oh, I can do that, after Petriana, something reference to, well, if I don't get through it. A resolution also for June, maybe I'll have it ready, but, something in support of the commissioner. I need to listen to his comments again, but he seemed to be right on point with the community board also, and health determinants, and how this is important to him, and what he said. Everyone was thoroughly impressed with what might be important for us is something that, says, yes, this falls in line with our healthcare determinants based on the budget that we put forth, and a lot of it did get approved, this year. So we'll see what's what, and then, perhaps that can come forth and, before May. Now, Patriana, I didn't get your draft, cause you said you were gonna add to that. It was not the final. Are you there?
Sorry, yeah, I'm trying to unmute. Yeah, so, hold on, I'm gonna turn my camera on. Just give me 1 second. Okay. Can you see me?
Yes.
Yeah.
How many
Oh.
pages?
Huh?
Also had a comment saying you need to reach out to the education committee.
Yes, that's what when I said Shanika and Deirdre, I didn't call them.
Education, yes.
Yeah.
Sent to the superintendent. Okay.
Of all the schools.
And then if you. you're
I'm on
already
the
working with
committee,
us.
but I don't know anything about superintendent of the school.
Oh,
I mean, I have no context, but I assume they do. Is that what you're saying?
and,
Yeah, yeah.
and then Wendy has also, they've already been emailed, so now we just have to really go back again. And follow up and be in person and make phone calls. Okay, I'm sorry. Petriana, if you email it to me real quick, I can forward it to the committee.
I did send you the draft. I'll just re-forward it to you.
When did you send it?
The 27th, the draft resolution.
Right, that's what I'm saying, but you said that you hadn't finished it, you hadn't completed it.
No, let me
Okay,
see. I'm
that's
I'm
what
going, I'm
I'm
going back to the email.
All right, just,
I could
if you-
re-forward it to you.
then
No, I
I'll-
was saying to you that the application hadn't been released yet. So yeah, and I said I had spoken to the office and it will be soon. So that's what I was saying, that the application, but I know you and I had talked at the fair, the health fair, that we wanted to not wait till last minute because last year we did a letter of support for the project with Main Street, New York Main Street, and they need a resolution. So I know that you told me it has to go through the proper channels, which is why we're starting now to reapply for that Main Street grant for Heritage.
So you did a resolution for us.
I did a draft resolution.
Can
So I
you
could,
email
yeah,
that right
I'll,
now
yep, I'm gonna re-forward it right now.
for the committee and it's easier if they see it in hand.
No
Say to
problem.
5, so that she'll be able to get out by 8:20 if she.
Forward.
I was under the impression you had to do more work on it, so it's better if we have it as close to, because we'll be making comments and.
So it's sending now.
Okay.
And let's see, yep, it just went through. So if you all need me to add anything or you want to take away anything, just let me know.
Talk about your project. Talk
So-
about it. If you want to take
Yeah.
paragraph by paragraph, talk about it by the time it comes. Maybe you will have gone through most of it.
So just to discuss the project, we're working on the construction of 6.
Petriana is the grant writer for Heritage Health Care Center. And so now you should tell them what New York Main Street, just in case they don't know generally, and then go specifically to your project.
So New York Main Street is a New York State grant under the Housing and Renewals Program. And what that grant does, it provides funding for different types of projects. And what we're looking to be is the anchor project as the health center that's on 1727 to move to 1649 Amsterdam Avenue. So the project entails a resolution from the community board to say that they are in support of the project of us doing the development for 1649. And last year we applied for the HVAC system. So we're gonna just reapply as for that same grant, but this time submitting with the resolution, with applying for the same thing as it being for the HVAC system. And I think the amount is that we're applying for is for $500,000. So I've been working tirelessly to obtain funding for the project. I know we did get 1.2 million from the New York State Health Department. So we are working through the contracting with DASNY. And I know Councilman Yusef Salam has supported us with a micro discretionary grant. We did apply again for capital, for New York City Capital, and we did get word that through HPD, the project can be funded through the housing portion. So that was about 6.5. So we're moving in the right direction. to find the financing, find the funding to get the project developed. And this is just another piece of that, that I know that our hope is that Main Street will fund us. And I know that in the past, Laquita had told me that Main Street did fund Heritage in the past, many, many years ago. So we're hoping that that will come to pass again this year.
Yeah, 3 different Main Street grants.
Yeah, well, we're applying for the Anchor project.
Are there any questions? Does anybody understand, what specifically was, it's not clear, Petra, what the money is being requested to do, should you grant it?
It's for the HVAC system, so, that's for the air conditioning, the heating, ventilation system.
Okay,
Why do we have to, why do you need a resolution for that type of request?
resolution, they're,
To fund it.
Because it's a
Mhm.
public grant, it's a New York State grant, so they want to make sure that that this project is being presented to the public. It's not private money, it's coming through the state.
Thank you, okay, that makes sense.
The resolution is always stronger than a letter of support.
Thank you.
Any other questions? Liz?
So she sent it?
Heather, Lena?
And so now,
Mhm.
do we need to do
One.
something like vote?
2,
Or
3,
what do we
4,
do now?
5.
I think we're supposed to review it, and I think,
Jordan.
are we gonna vote on the resolution?
Do we have the
We have
resolution?
to, we need to.
Right, I'm sending it, that's what
wait.
I'm.
Oh, there's already a
Yeah, I thought she was
resolution?
gonna be doing
Okay.
some more to it, but anyway, let me.
Did you want me to
I'm
add more stuff to it,
forwarding it.
Laquita?
I think as long as you're satisfied with it, because they're gonna be looking at it right now, I just emailed it to the group that's here. So,
Okay.
and it's everybody here, the whole committee.
Yeah, I guess.
So let's just see.
What I did was I took the letter of support from last year and just made it into a resolution. And if there's anything else the health committee feels like needs to be added, I have no objections.
Did you get it? Yeah, I got mine. Is it, you haven't gotten yours, Kim? Let's see.
There it is.
You haven't?
Yes.
I always have to count 1, 2, 7. If I see 7 names. What did I see? Monica, Edwin, I can move forward just in case.
So Heritage Health is applying for HVAC for the new location at 1649 Amsterdam. I'm fine with it.
Yeah.
Motion to approve this resolution?
No,
Oh,
to my,
second.
what is it?
Unanimous consent?
I mean, if the
I wanna
bottom line
make sure
is
it's our hands up.
it's gonna benefit the clients, I mean, it's a no
Everyone needs air conditioning.
I'm actually-
They're providing healthcare for people, they want an HVAC, they can have an HVAC.
So the half, when you say a $500,000, it's going for air conditioning
And
Yeah.
some building maintenance, it
and
looks like.
some business, just for 1649, because that would make sense. That's
Yeah, cause
in,
they have to move out of 1727 and then
Right.
moving into 1649, so
Right.
they're.
and that's a landmark area also.
And they're.
And that's a landmark building.
Yeah, so they've done everything according to this resolution in conjunction with the landmarks committee. And
Ah.
some of that money is going towards upkeep of the building to
Mm-hmm.
keep it in line with preservation. So that's why it's more expensive than your traditional HVAC, because they're also, yeah, there's careful, they're gonna do restoration appliance.
I lost
Limestone,
you
so that's
guys.
Stone splatters, lintels, period appropriate facade materials.
She's reading what you,
Yeah,
she's
basically-
saying how the money's gonna be used.
In addition,
That letter of support like several years ago.
And she did say that she took the other letters in the resolution.
I
I think the unanimous consent was still on the table.
Yeah,
motion to unanimous consent pass this resolution that we just got emailed.
From the committee.
yes.
Second.
Great, go Cats.
Yes.
Are there any?
Now, so is there something else you wanted to work?
I just
I'm
have a
s-
question.
Yeah.
Are you all still implementing solar panels on that roof?
I don't believe that we ever were, because again, it's a landmark building. I would have to go back and double check, but I don't think we're able to put, solar panels on top of the roof.
You are, I think I remember seeing that in the original drawing.
That might be a plus, right?
Yeah.
And that could be a plus.
I was the chair of the landmarks committee when this came before the committee
Yeah.
several years ago, and I wrote the letter of support for what you're asking for now, so that's why I'm asking, that's all.
Yeah.
Right, and I think I had taken that out because when I did research and I spoke to Doug before, I want to just make a correct, I'll just double check that, but I think it's because we're landmarks, we can't put,
No, you can definitely have solar panels on.
oh, you
landmarks.
can't, okay, all right, so I will double check to see if that's part of the scope of the work with the architect.
Yeah, they have a whole special approval process for that, just dedicated to solar panels.
But then
Okay.
but for this grant, for this resolution,
Like, this was an aside question, I'm just asking.
cool.
I'm asking her that.
Okay.
But
I will double check with the architect and with the president.
Well, do we have any other questions like that since, she is gonna take another look? Was there anything else, Heather?
Because my
That could
question,
be a strong point
Right.
for them getting it.
because will she change it now to add it?
I can do that right now,
I wasn't.
No, you don't need
but,
it right
but I
now.
don't know if it's a part of the scope of work, but that's what I'm saying, so,
Yeah, don't worry about it.
okay.
No, I don't think, don't worry about it. Look at it and see, because New York Main Street is extremely competitive, and if that's a
yeah,
plus.
energy efficiency, because
Yes.
HVAC uses a lot of energy, that's why I'm gonna look to see the original drawings. if I
Be in
can.
touch with Heather also, you have a little time, we need the final, well, the committee's out here, that's a good thing. But in that final, send me a final so I can get it to this group.
Okay,
Well,
I'll confirm it tomorrow. I'll see if I can get someone on the phone tomorrow and find out if see if I could get the scope of work, if they're gonna do the solar panels or not, and then if they are, I'll put it back in.
If you attended a session, they do those sessions because they are extremely, I can't say it enough, extremely competitive, so that can
Yes.
give you an edge.
Yeah, they
Thank you.
haven't started
Okay.
yet, so I think they start in the end of May, beginning of June to put the RFP or the grant proposal out. But I did speak to the young lady that's in charge, so so she does recognize who we are and what we're trying to do here. And when they sent us the letter, they just made it very specific about us needing a resolution. And I think I shared that with you, Laquita, early on this year.
They're very strict with all of that and the timing that it comes out, all of it. So, yeah. We were fortunate to have gotten, 3, in the last decade. So, okay.
Thank you,
so
guys.
Let's talk,
I don't think
before the week
that,
is out.
yeah, I don't think that we need that for this.
No, we don't.
That's
it's
just for
just
their
that.
application.
Well,
Okay.
she said, and she's also trying to get ahead of it. That's why I also didn't want to
I think
dismiss it.
our resolution still passes.
Yes.
Just like as but also, I finished the No More 24 one.
motion
wow.
to vote on Cameron's resolution?
That's what the real deal is. Let's get through our other, okay, Pam, Sandra, thank you so much, and we'll hear from you, before, our executive committee, just to go over things and maybe to let someone else put their eyes on it as well, have someone else that could be helpful. Okay?
I'm muted. I'm gonna be in touch.
You're muted.
Yeah, I'll be in
Or
touch
something
to,
else.
can you hear me now?
Yeah.
Yes.
Okay, I'll be in touch tomorrow with you, Laquita. What I'll do is I'll find out about putting back in the solar panels, if that's still, on the table, and then,
No, be in touch with Heather on that.
Yeah, I'm
Okay.
looking at.
I don't have Heather's information.
The drawings do show solar panels,
All right.
so we'll be able to.
We can-
Wait.
I'll send
Okay.
I'll send you Heather's contact information, right?
Okay, you have my email. It's pacosta-pelly@heritagenyc.org.
It's on your email that I sent to them.
Okay, great. Thank you, guys. Appreciate it.
I'll put my contact information in the chat.
She's gonna put her contact information in the chat as well.
Okay, great.
For
I'll send you
Cameron.
an email right now once you once you put it in the chat.
And thanks for your patience, Pat.
Oh, I'm here. You know I'm here. I'm always here to support. I'm a former community board 9 resident, so
Okay.
yes.
All right. Cameron.
Yeah, and I just put this in the chat. So anybody who's in the chat can take a look. But yeah, so it's resolution in support of 303. New York employs more than 200,000 home care workers, largest occupational group. It's legal for home care agencies to assign workers 24-hour shifts, compensating them only 13 of those 24 hours. I talked a little bit about sort of the scientific evidence that demonstrates that prolonged wakefulness impairs hand-eye coordination, decision-making memory, up to it's essentially equivalent to a 0.1% blood alcohol content. So it's like you would not legally be able to drive, but you're allowed to take it.
Most vulnerable human
These
being.
meds.
Yeah.
Exactly. High turnover, high burnout, occupational illness, a lot of them are dealing with chronic insomnia, weight loss, physical injury, and other chronic conditions. It talks about the No More 24 Act to prohibit them from scheduling them for shifts longer than 12 hours. Or from assigning them for more than 56 hours per week unless the employee consents to excess hours in writing, and they have the right to revoke their consent to work in excess of 56 hours per week. There's also a companion bill that was actually proposed in like 2021 at the state level. And so we're actually just supporting that as well and saying, like, hey.
You made reference to it,
Yeah,
or
made
you have to
reference
take a
to it.
statement from it? Okay.
And powers the Department of Consumer and Worker Protection. So yeah, we're basically calling upon the mayor, champion and signing No More 24 Act, calling upon the governor, of New York State and the New York State Assembly and Senate to support state level legislation to abolish 24-hour shifts. And then additionally, standing in solidarity with the home care workers, copy of this resolution transmitted to the speaker, the mayor, the governor, members of the New York City Council Committee on Civil Service and Labor, then also our city council members and state legislators for this district. So that's about it.
And so I know that's an abbreviated, so you're taking details from that, some of the 303 bill?
Yeah.
'Cause I know you were speaking in.
Yeah.
kind of-
Yeah, that's all. That's all.
Okay. Okay,
Thank
so
you,
we'll
Cameron,
still
for
see
that.
it,
Yeah.
So do we wanna vote?
so we're voting on the draft,
Yeah.
and then that he was
Motion to
submitted.
vote on the draft
Right.
Cameron's resolution.
Mhm.
Sent it to Zach.
And then you'll have time to have input this week.
Yeah, no, it'll
And
it'll go to executive, what we'll do is we'll just ask at executive committee for them
No, we
to.
can do it in advance, let
Yeah.
Victor know, but let's say Monday. And then whatever comments people have, it'll give you a day
Okay.
to kind of like put all those comments together, no, 2
I don't
days.
need to comment.
Put all
Yeah,
those-
anybody-
just read it.
Yeah, I'm good with it being done.
Right, I think
Me
it's
too.
complete.
Yeah.
You wanna read
It's
it?
always
see
good,
it.
I think it's always
We
good,
can,
policy.
so I. will-
Unless we really were like, the next
Cause
day.
we have 10 days for it to like have made an impact.
Mm-hmm,
Yeah, I do
So
worry about
it.
I-
Just if you
I'll
can
send
have
it to everybody via email,
mm-hmm.
and just reply, yes or no.
By
Yeah.
like, when, just give
And
us
then
a
anything
deadline,
to
if you don't
add,
hear
yeah.
back, then that's it.
And
You
then
don't hear
if
back from
they
me, I
usually
vote
want,
yes.
stuff on Tuesday.
I think, no, I
So I
think you
think
should
that-
reply, say yes or
I
no,
will
so it's
reply.
clear.
Yeah.
Then
And
nobody's thinking.
I will reply, yes.
Yes, but some people may not, so you don't wanna just go.
Exactly, indicate, cause that happened, something else that went out, like, the person didn't say what they wanted, they didn't
Yeah, I'll
ask.
send you a.
Why don't we
Yes.
vote on the draft now and then we vote to accept all comments that at Cameron's discretion?
It's the same thing, send out drafts, we can make comments, and either way,
24 hours.
yes.
24 hours. That's
Hold
the-
on,
Yeah.
let's-
I like that.
Hold on, let me just say, we sign our name, yes, in favor, no opposed, which there's not gonna be, I'm sure.
Okay.
And then just add any comments. That's just clear.
Okay, works for me.
And then we get a final, so we're all on the same page. Cause, Jordan may show up at executive, Linda, if you're available, everybody can show up at executive, just remember that, guys.
Right, thank you.
This is from today.
Okay, so is there any, new business? I think there is, but it can wait, I can wait. Any other old business? I think we covered everything.
Hunting squirrels.
We should.
All right, so it is now 8:24 PM. Yes, thank you, everybody who's been online with us, on Zoom. Thank you so much. We look forward to seeing you, soon. All those in favor of, or can I get a motion to adjourn? Second, and then the second.
24.
8:24.
8:24.
Out early, love to see it.
Yeah, and I'm gonna watch the Nick game.
This is the first game in this next thing that they
This is
do.
the first
It's called the,
play.
something.
Yes, really.
Did you?
It's this East, I don't understand anything.
Eastern Conference
Eastern
semifinal.
Conference semifinal. And then whoever wins this
I
goes on to
printed out
the other
the
people, and that's the final.
I did
print out, but
Eastern
Thank you,
Conference.
guys. Have a great evening.
Thank you.
After this is the final.
This is
There's two more.
Okay.
Does anyone know, is it on, like, antenna?
Oh, that's a good person. Because you're right, one night it was on four. Right?
But
you can just.
Yeah.
It's not,
My thing is, let's,
but.
I don't have any.
let's.
Good night.
I'm like, you ever got any?
Thank you.
I'm just gonna.
Thank you. I don't know if it'll.
Maybe it's like, wait.
Good night, everybody.
Let her say, good night. I took out the